But first, the largest study of its kind has found that there is a genetic element to ME. Scientists have responded by saying this will put ME on an equal footing with other debilitating diseases and also open up other potential treatment options. I want to know if you have been told that your ME isn't real, that it's in your head, and if so, what you make of these findings. It's 3 minutes after 7. Now, if you are a regular listener to this show, you'll know that we've hosted a number of phone-ins in the past about ME, and it's something that I keep an eye on. One of my heroes, Georges Monbiot, writes about it a lot, about how there is what he describes as a scandal behind the way that people with ME have been gaslit about their condition, told that it's all in their minds, told that it can be solved with exercise, none of which is scientifically robust. And this week, the results of the world's largest study into ME were published. It was conducted by the University of Edinburgh and involved testing 27,000 people with a diagnosis of ME and 250,000 people who did not. And what it found was that there were 8 regions of genomes substantially different in those who have ME and those who do not. So what that means is that there is a genetic causation. There is a genetic link to ME, and that's really significant. Sonia Chowdhury, who's the chief executive of Action for ME, says people have been disbelieved even by doctors and told that the condition is not real. And scientists have responded to these findings by saying it's going to put ME on an equal footing with other debilitating diseases and also open up other potential treatment options. So this is huge. An investigator for the study DecodeME, that's what this study is called, described it as a moment of change for the population and a wake-up call. So I thought I would take the opportunity to ask you this hour what this means to you, what these findings mean to you. If you are somebody with a diagnosis of ME or perhaps a diagnosis of long COVID, which are not exactly the same, but there are similarities between the two, and you feel that you have been gaslit or you have had people in your life that have told you that your condition doesn't exist, we have a study now that shows that it absolutely does. It's measurable, it's tangible. How does that feel for you? Tell us a little bit about your experience and what this new study does in terms of, I guess, contextualising that experience. 0345 6060 973 is the number that you need. We're joined now by Sarah Boothby, who's a campaigner on ME and chronic fatigue. Thank you so much for joining us this evening, Sarah. First of all, would you mind telling us how you came to be a campaigner on this issue?
That's a great question, Natasha, because I honestly did not think of myself as a campaigner. It's kind of, I've been pushed into it because I'm not somebody who, firstly, injustice has always motivated me to act anyway. And secondly, having seen what I've seen, so close and so personal, I can't just ignore it now. You know, my daughter died from medical neglect of ME, and I'm a qualified social worker, so I know that the laws in our country are designed to protect patients like Maeve from everything. You know, disabled people are vulnerable, children are vulnerable, older people are vulnerable, and we have a really good legislative framework to protect those people. And yet, with ME, it does not work. It does not work. Well, that for me is complete. I mean, that is the perfect example of what injustice looks like. You know, here we are, a free speech country, and we create all of these laws. We vote for people who create these laws for us. And then suddenly, if you've got a diagnosis of ME or chronic fatigue syndrome, they don't work for you. I want an explanation, please. So that's how I became a campaigner, to try and get an explanation, to try and get some facts out. And as soon as Maeve died, well, before she died, I've been on this journey, you know, the discovery of what Georges Monbiot has identified since 2018. And when I first discovered what was at the root of it, I was sitting on a platform with my train right in front of me. You know, I was a full-time carer. I had arranged the cover I had to get back, and that train pulled out while I was sitting there in a state of dazed shock. I couldn't believe that this is the country that I live in. And then lo and behold, 2021, it's all brought home to me in the most vivid reality. And if I cry, please excuse me, it's because it's terribly sad when your only child dies.
Of course.
But that doesn't impede my drive to make sure that it doesn't happen to anyone else.
And I'm so sorry, I should say, about Maeve, and thank you for sharing that with us. When you say that the system is just not fit for purpose and it doesn't acknowledge people with the diagnosis of ME or chronic fatigue syndrome, what do you mean by that? What is not there that should be there to support them?
I think the root of this, and I would really welcome people who are listening, because I know that they know as much, if not more, than I do about this, that they challenge anything that I have to say if they think it's not true or if it's inaccurate. The most important thing for me is that we get the facts out there so that people do understand that they've got a risk assessment to do. They've got to make a judgment based on clinical observation, and they're just not capable of doing that at the moment. So the first priority for everybody should be patient safety, regardless of who they are or what they are. If they're part of a health and care service that is nationally funded, patient safety should be their top priority. And the muddle comes for everybody involved professionally. And I say this as a professional, a former statutory services professional myself. ME is not chronic fatigue syndrome. It never was. And to confuse the two is a disservice to both sets of patients. Chronic fatigue syndrome is a term that was invented by psychiatry to give itself a kind of legitimacy that it doesn't have now, and it's never really had it in medicine. ME was a condition already in existence where, as now, it's only because patients speak up for themselves that there's any kind of recognition, because there's never been research done into it as a biomedical condition, which is why it's an exciting time for everybody with Chris Ponting's public. But it's a preprint, so I'm expecting the people who have to defend themselves with chronic fatigue syndrome will be pushing back on this, and that's not such a bad thing. It's how good science works, and it's how good laws are made. But when people are dying and those people take no responsibility for those deaths and pretend they're not actually happening, and the entire British medical establishment is implicated in this, then there's something really rotten. Really, really rotten at the heart of it.
So when you say that ME and chronic fatigue syndrome are not the same thing, what for people who aren't familiar, can you clarify that a bit? Are we saying that they are distinct conditions, one of which is psychological and the other one is neurological, or have I misunderstood?
No, and it's difficult to define because there is no biomarker for either condition. But I worked for a long time in specialist mental health services, and I loved the work as a social worker. And I saw a lot of people who had severe and enduring mental health conditions. The specialist service that I worked in, we were only ever seeing people who had been detained under the Mental Health Act. And many, many, many of them had CFS in the long list of diagnoses that they had been given. Those patients deserve as much of a service as anybody else. And by reversing the order CFS ME to ME CFS, they are still muddled up with all of the people who have ME. The defining characteristic of ME is something I'm going to ask you a question now, called post-exertional malaise. What do you think post-exertional malaise means? When you hear those three words, what does that make you think?
I would say that it would be taking a really long time to recover after doing exercise or exerting yourself.
Okay, and when you think of exertion, good answer, by the way, well done. You've been listening. But when you think of exertion, what would you include in that? What is an exertion?
Well, I would say the thing that it instinctively brings to mind is maybe going to the gym or going for a run or something like that. Some kind of recreation that you would do to keep fit.
Right. Fantastic. People with ME, if they do that, which is what everybody knows is good to keep you healthy, they will make themselves more unwell. And nobody knows but them what that's actually like. There's something like, I haven't actually tallied it, but there's something like 200 different symptoms in ME. And so from the point of view of the GP, you've got this person coming in saying, every time I go to the gym, I feel X, Y, or Z. And the GP's going, I keep seeing this person coming and talking to me about all of these minor things. They look perfectly okay to me. Maybe they've got hypochondria.
Right.
How can there's no biomarker, there's no test, there's nothing to show. And, as Professor Ponting has said, his study, the publication of his study, is not giving us that marker either. So there's going to be plenty of scope for the psychiatrists who are trying to establish a base for themselves in medicine to say, well, all of these things could just be affirming what we've said already. Until we get the biomarker that demonstrates PEM is real, and in the early stages of ME, when it's mild, there can be quite a long delay between the activity and the symptom onset. So, but with Maeve, so I saw this with my own daughter from, she had a mild infection at 12. By 13, she was writing in her diary about feeling tired all the time. And by 26, she was unable to move a muscle. Everything had to be done for her. She couldn't sit up. She couldn't chew. She could only swallow 15 ml of liquid at a time, and all of that had to be paced throughout the day. I was caring for her completely single-handed, 24 hours a day, even when she was in hospital, because the nurses did not have the time to feed her orally when she couldn't sit up, and the doctors didn't know what was wrong, and for them, the risk of tube feeding her was higher than the risk of allowing her to starve to death, which is absolutely staggering to me. But they could not see the patient right in front of them. It's just, I'm speechless at that, because for me, that's the first thing that you assess. You can see this person can't move. They can barely talk. They can't turn themselves. They have to be turned. And when they are turned, they cry out in pain. How can you just turn your back on that? I know the hospitals are really busy. I was there all day, every day, filling that gap for several months. By the time you put it all together, she was discharged home medically fit in that condition 3 times. And the last time she was discharged home medically fit, they claimed at inquest that they knew she was going to die, but they didn't put in place for her any palliative care. So these things just don't make sense, do they? It just doesn't make sense. And it doesn't make sense because if you're a doctor, you look at chronic fatigue syndrome, which is the only code that you have to enter the patient's details under, and chronic fatigue syndrome sends you to a behavioural program. So you've got somebody who maybe they've got something like anorexia, maybe that's why they're not eating, because those wards see a lot of people with anorexia, and yet there's no blood test that's telling them that this is an anorexic patient. The blood test is telling them you've got a very healthy, well-nourished patient, because she was healthy and she was well-nourished until the ME progressed to the stage that they were seeing it at, and none of them had ever seen it before. And none of them, a bit like you, which is no criticism of you or of them, knew that exertion in ME means an external demand, anything that is asked of you that you don't have control over yourself. So you can't pace yourself. The amount of energy you've got within your body is limited, and only you know what you can safely do. So family members, for example, think, so this person picks and chooses what they want to do. That's not very nice. That looks like they're being really selfish. It's like far from it. They could not be further from the truth.
It's such the way that you have spoken about it, and it's no surprise considering the experiences that you have, has really, for those of us who don't have direct experience of ME, it's really brought some clarity to what it actually must feel like to go through that. So thank you so much, Sarah Boothby, their campaigner on ME and chronic fatigue. And what I'm hoping is that this study will bring further clarity, that it might even result in that biomarker that Sarah was talking about too. But in the meantime, what I imagine that you would feel if you have experience of ME is validated, because this genetic link has been established. But I want to hear from you how you feel. This text has come in from Daisy on 84850 who said, I grew up with a mum with ME and I was diagnosed 2 years ago. And I can tell you that ME patients have known this for years. It's so validating to have science-backed evidence at last. And I'm so grateful to DecodeME. Unfortunately, I'm sure the stigma will be around for a while yet. I'm really fascinated by that element of the stigma of the illness and the quickness that people have to dismiss it or even make fun of it. As I'm saying that, there is a stand-up routine that I'm thinking of that by a very, very famous comedian who took the time to ridicule ME. And I'm sure that moments like that do stick in the public consciousness. So this study, I think, is significant because it's something tangible that you can point to, but it doesn't eradicate stigma overnight, which you're very right to point out, Daisy. Let's go to the calls. Fran has called from Sheffield. What would you like to say?
Hi, I'm just calling as a person with severe ME, as someone who actually can call. I was very severe for a year, so I was unable to talk, stand, move at all, and I've improved a little bit. So I guess I'm calling on behalf of everyone who can't do that to talk about this experience.
Thank you very much. And what is it that you wish that people knew or you feel that is misunderstood?
I think, so much is misunderstood about this disease. Very much the fact that it is a completely biological, pathophysiological illness. It isn't, psychosomatic in any way. It's not linked to mental health, other than that your mental health might not be that great if you're severely ill. But that is the only link. And you can't fix, it doesn't work like other things. You can't try harder and fix yourself. The harder you try, the worse you get, which feels so different to any other disease. And your mindset won't cure you. You can't think your way out of it. And I'm not sure people would even suggest that for other diseases, but we get it suggested to us all the time. It's like, why would that cure our, very much biological neuroimmune disease?
Well, it's not even a good way of dealing with mental illness either. When people say, just have a positive attitude, that's not a helpful thing to say to somebody with depression. No. But it's also not a helpful thing to say to somebody who has a condition which is neurological and genetic in its nature. I wonder, how have your friends and family dealt with your diagnosis?
I would say overall I've been pretty lucky, but I have still had, and again, it shouldn't have to be like this, but I was like a marathon runner. So I went through a marathon runner I was mild for a bit, and then I was bedbound due to a COVID infection. And so I think people can see I would never choose to do that. To stop running. But even so, I have still had people close to me who've often gone down like internet rabbit holes, suggest, it is a mind-body disease. You can do this course that's going to fix you by retraining your brain, which again is just not, might help with maybe some of the mental side of things, struggling with that side of it, but it's not going to fix a biological illness. And I even had people saying that to me, when I was a bit like what Sarah was saying, people not seeing the patient, someone who was flat in bed, couldn't sit up, could barely roll over, could barely talk, couldn't even open my eyes, basically for months on end, like saying to that person, you can just think your way out of it, just seems ludicrous. It is like people can't see what's in front of them, and that must be from the years of stigma behind the disease.
Yeah, and it also reminds me of, so I went to a lecture once which was by a woman who was talking about how little is known about women's bodies, and 4 times more women are diagnosed with ME than men. So there is a gender element to this. And she was saying that if you drop your keys and you're near a lamppost, you'll look where the light falls from the lamppost first. And she said some people just keep looking in that circle of light, even though the keys are actually in a hedge somewhere. But it's like they're so fixated on where the light lands that it doesn't occur to them to look anywhere else. And it occurs to me that's kind of what it must be like to have ME, where it's like they're testing me for literally everything else and it's coming back that I'm fine. But it's because they're not acknowledging that the thing that's actually wrong exists.
Yeah, definitely. And that's, with it, I was going to say as well, this new study is amazing, but we do actually already have a lot of evidence about that ME exists, but it's often, tests that are hard to get, certain types of MRI, or doing like a 2-day CPET test, which is you can't do when you've got severe ME. There's various things that have been found, abnormalities with the heart, in immune dysfunction, but again, tests that you don't get on the NHS. So it's like, just because all of those just standard tests come back normal, it's like, oh, there's nothing wrong with you then. It's in your head. Whereas actually, we've already got evidence. We don't know the exact cause, but we've already got evidence that there's changes that often just gets ignored by doctors because they've not, there is no mandatory requirement for doctors to keep up to date with information about ME, which massively needs to change. We need all medical staff to be retrained with the latest up-to-date guidance on how to care for someone with ME and what we know about ME scientifically now, especially after the DeCode results.
Fran, thank you so much for your call. I really appreciate you, as you say, speaking on behalf of all the people who can't pick up the phone. Lots of text messages coming into the studio for that exact reason, and I'll do my best to read as many of them as I can. This from Daniel, who says, as somebody living with ME, the DecodeME findings are very welcome. However, the years of stigmatization and medical gaslighting will take a long time to move on from for so many of us. Sherilyn has called from Red Hill. What would you like to say?
Hello, thank you for having me onto the programme, and it's been lovely to listen to your other guests.
You're welcome.
I won't be so eloquent because my brain is really struggling at the moment, but I just want to impart that I've had ME since I was 17, although it wasn't diagnosed till my 30s when I suffered a complete collapse and ended up in a wheelchair. I spent several years in a wheelchair, and I then got quite a lot better through doing the Alexander technique, and that really, really helped me. But going through the medical services has been absolutely galling, really frustrating, lots and lots of gaslighting, sent all round to different specialists as each symptom has pointed towards something very serious, and nobody has been able to find it, and then I get bounced back to the GP again, and it's been like that. I'm in my 50s now. I've missed a lot of life. I once enjoyed singing. I once enjoyed teaching children. Actually sang in London in a professional choir, but everything I've done has ended with a collapse, a sort of burnout. And it seems that the only things that are on offer in the specialist ME clinics are pacing, which is like an energy management thing, which you do for 6 modules, and cognitive behavioural therapy, and that's treating it as if it's a mental condition.
Yes. Yeah, I guess it's trying to reframe your perception of the situation rather than actually dealing with the situation itself.
Yes, and the help hasn't caught up with the changes and the science. There's a lot of research going on around the world, as far as I know, but little projects with very little money, and they can only get so far. For example, Stanford University with Ron Davis is doing some good things on the metabolism, but it just seems that even our medical professionals don't know about those. I had to say that to my ME specialist clinic. They didn't know what was going on, and it just seems there's no joined up care.
And in terms of these studies that are being done throughout the world, is there anything that they're showing in terms of a really effective or even a relatively effective treatment that could be offered?
The Ron Davis at Stanford University is talking about the cycle within the cell and energy production. And if you imagine what an underground map looks like and thinking of that as different neural pathways, there's things that aren't actually working. So it's almost like a break in the circuit of metabolism. And it's quite complicated. There's quite a lot on YouTube if you type in Ron Davis and the itacamate shunt. It's not everyday language, but it's very interesting. His son is seriously ill with ME, and he's very dedicated to the work. And, you know, we always hope something will come from that it is the energy produced that is not being metabolized properly. So within the cells, so you can eat, you know, healthy food, but it doesn't necessarily get metabolized properly.
Yeah,
I hope I'm making sense.
It makes total sense, Sherilyn. The nutrition is not getting where it's supposed to go. Sherilyn, thank you so much for your call, and you were very eloquent, so I wouldn't have you worry about your contribution to the conversation. This anonymous text on 84850 says, "Hi Natasha, please don't say my name. I took part in this research and would love to call in, but I keep my ME a secret. The main reason for this, and one of the things I hate most about my illness, is there's no test for it. This obviously leaves it open to doubt and judgment from those who think if you look okay, then you are okay. These findings give me hope. Firstly, that a test can be developed to prove the illness, but mostly the hope that one day a treatment can be found." Let me read out some of the text messages that you have been sending in. So this from Carla, who says, "Natasha, these findings will take some time to be accepted and repair the damage that some health professionals have caused. We still live with the history of it being yuppie flu back in the 80s and 90s, but attitudes of other illness have changed with the right backing. For me, it's also a step towards cure." Tom says, "Hi Natasha, I'm Tom, a writer and musician from Suffolk. I started to suffer with ME after a strep infection in 2017, aged 26. I was repeatedly told by doctors it was depression, it was stress, it was all in my head, etc. Now, almost 5 years on from my initial deterioration, I'm 34 and still mostly bedbound. My old life is gone, my loved ones and my carers. This study is a vindication for patients like me. There was no genetic link to depression or anxiety found. Instead, the genes found suggest the involvement of the immune system and nerves. We are all reliable witness of our own illness after all." Adam has been in touch to say, "Natasha, would you mind recapping ME, please? Been listening for 15 minutes and none the wiser to what the illness actually is." This is part of the difficulty with it. I would say it normally begins with an infection, after which people start to experience extreme fatigue, a difficulty in recovering after any kind of exertion, brain fog, and these are symptoms which have overlaps with other illnesses and conditions. But what the latest finding shows is that it has to do with a lot of different kind of chemicals and genes and balances and parts of the brain that you can measure for it, and therefore it's not purely psychological, and that's why this latest study is so very significant. It's 7:48. So just to recap, if you are somebody who is not affected by ME and you have tuned in, many patients report an infection before symptoms begin. These symptoms include extreme tiredness, brain fog, sleep issues, and taking weeks to recover following physical exertion. As well as these genetic differences that have been found in this study, studies have also found people with ME have high levels of lactate in their anterior cingulate cortex, which is a brain region that integrates information regarding effort and emotion. So given that we've had this largest study that has ever been conducted into ME, and it's found that there are 8 substantial genetic differences between people who have ME and people who do not, I'm imagining that feels very validating for people who have been gaslit into or not into believing, because you would never believe that an illness you were suffering from wasn't real, but gaslit by people who do not believe that it is real. And that's the question that I'm asking you. What do these findings mean to you? Sue has called from Devon. What would you like to say?
So this is like really, really important, because I'm heading towards 60, and I've had quite a lifetime of this, and it started with feeling tired all the time. And like most people, when you're feeling ill, you pick up on the main symptom and you go to your doctor. I was told, do more, and had various hospital admissions, including operations, which I now question whether they were necessary. After a while, I kept doing more. I became really ill. I was running marathons. I was surfing, cycling, long distance. I ran my own business, healthcare professional, bringing up a family, attending university, all at the same time, because I was told, just keep doing more. And I did. Eventually, I became so ill. And my GP said to me, it's behaviour. You choose to behave like this. You're lazy and you have depression, and prescribed me an antidepressant over the phone, not even face-to-face. And I became so ill, I was sleeping 24/7. And because I was a healthcare professional, he told me that I was awkward to deal with because health professionals are. So there's no compassion. And I think Sarah earlier sort of stated on that, my antidepressants were actually the cause of me having seizures.
Oh, wow.
And it was a really good pharmacist who said, you're having serotonin overdose because you actually don't have depression, because there is no shortage of serotonin. I paid for a private mental health assessment, which came back as there was no identified mental health concerns. I got admitted to hospital again. I was told by a consultant, again, it was behaviour and it's because I was abused as a child. And I said, but I wasn't abused as a child. He said, oh, it's because your brain's blocked it out. And I said, how dangerous is that? Because
What a massive worry to give you.
Yeah. And I've got the guts to turn around and say, no. And I have people behind me to say, that's rubbish. But you said that you say that to someone else, that could trigger something else that they really don't need to be dealing with. And I told him that without the evidence, he should not be doing that.
Yeah.
And I did report it. I then turned around and asked to see a special consultant that I knew, and neurologist, and I'd known him professionally. And I turned up, and he said he went through all my records, and this is just pre-COVID, so you're sort of 2019, and he said, I'm tracking this back to starting in 1994.
Wow.
So I have all that gaslighting, all that negativity, and then recently I went to A&E for something, and the doctor said I've never heard of ME recently, within the past year.
Wow.
You're like, so they're not getting the training.
No. And what you said earlier as well, from reading some of the stories that people have posted online about their experience of ME, about being perceived as difficult, that is a recurring theme that comes up again and again, that I was told that people like me were inherently difficult. And it is because you don't fit neatly into the established criteria of what people know. So you're inconvenient for them, but that's not your problem.
No, exactly. And, and to be told, well, and I remember saying to one of the doctors, would you treat your family like this? If this was your daughter, your sister, your mother? And she said, yes. And I said, well, I'm really glad I'm not related to you. Because as a healthcare professional, I would never have treated any of my patients like that.
So thank you so much for your call. I'm only moving on to squeeze in another one. And also, Hillary's been in touch and said, hello, Natasha, you said not purely ME is 100% biological. There is nothing psychological about ME. I don't remember saying that, but I trust you, Hillary, that I did. And I'm very happy to correct myself. Yes, this is a biological condition, which is what this latest study has proved. Rowan has called from the Isle of Man. What would you like to say?
Yeah, hi. I've got something called chronic Lyme disease, and I got a tick in Richmond Park in 2010.
Okay.
and obviously I've had a lot of treatment for that, but I do get ME, and before that I was a disbeliever.
Okay,
so
interesting.
I suppose, but also I was a social worker in London, and I remember visiting clients. I can remember one young girl of 14, and she was in bed, and she was really, and I was just really disbelieving of what she was experiencing. But I now know from my experience that I think viral or bacterial infections can affect your whole body.
Yeah.
And then you have some sort of weakness, and until you have ME, and I'm literally a very fit and healthy person, or was, you just can't believe the effect it has on you. You just crash. And it's quite profound. So I've got I keep going back over people I've met in the past and thinking, oh my, Lyme disease. But that's just one of the many diseases and bacterial or viral infections you can get that sort of affects your immune system.
I know somebody who had it after glandular fever. As well,
Yeah,
and it's terrifying, isn't it? The thought that any of us could get one of these infections tomorrow, and you just don't know whether you have this genetic predisposition to then developing the symptoms of ME. Rowan, thank you so much for your call. Chloe has called from Bradford. What would you like to say?
Yeah, hi Natasha. Thanks for taking my call.
You're welcome.
I think I initially called to sort of just share my story, but I think one of the questions you've asked is with regards to how people feel about the actual research. I think there is a little bit of excitement for me personally, where you do feel finally there's some recognition, and you do feel that obviously you're justified in sort of explaining to people there's something wrong, and that this actually shows that you're not lying, there is something there.
Yes.
My big fear is it's a big load of nothing, and it will end up without the funding it needs, without the research it needs, without the support being piled into it to make sure that sort of we can use that information to find treatments, to find cures, and to further explore what the reasons are for this. It is a good moment, but it can't stop here.
Yes.
It can't just be that. It has to move on, because people are suffering out here.
Of course, Chloe, thank you so much for your call. And that's a really good point to make, that this needs to be the starting point for further action. Just a time for a couple more texts. Trudy says, I've been diagnosed with long COVID and ME. I've been treated like I'm a liar and making it up, as I don't look ill, but constantly struggle every day. And I'm very limited into what I can do, constantly in pain and needing to rest and sleep. This new diagnosis is such great news and a relief to many people in my situation. This text says, I have severe ME, but set an alarm to wake me up at 2 a.m. so I could listen to this segment live from Western Australia. I wanted to emphasise that DecodeME, the study, is bringing much needed hope to ME sufferers, not just in the UK, but worldwide. And whilst we're all painfully aware that any practical outcomes from this incredible research will still be some years away, the nature and scope of this study will hopefully take us a lot closer to doctors, governments and society finally accepting that ME is a debilitating, complex physiological disease. It will send a strong message to decision makers that what we suffer from is a genuine disease. Thank you so much for all of your contributions that hour. As I say, we will return to this topic